This morning, Kentucky Republican Senator Rand Paul sent a letter to his boss, Senate Majority Leader Mitch McConnell, with a list of proposals that he claims would make the GOP health care plan a little bit better. Among his ideas, ending insurance company bailouts, eliminating the individual mandate by any other name, and allowing Americans to band together to purchase group coverage. But will these ideas work? Nick Gillespie joins me now, editor-in-chief of Reason.com and Reason TV. Welcome back.
Thanks for having me.
So you're nodding. Is it enthusiastic?
Not a lot of enthusiasm about government health care, but I think Rand Paul's points are totally exactly where we should be heading. One of the big problems with Obamacare, and one of the things that Republicans have been railing against for years, are these bailouts to insurance companies that lose money on the Obamacare markets. The Senate bill would continue that and actually grow it a little bit more. Rand Paul is right to say get rid of that. He's right to get rid of the continuous care provision in the Senate bill, which is the individual mandate by another name.
That's exactly right. And in the Senate version, that means people have to sit out for 6 months without health care.
And then pay a penalty as well. And it's just, if the whole point of one of the main attacks, and I think it was a legitimate attack on Obamacare, was the individual mandate, the idea that the government can compel you to engage in economic activity that you don't want to. And this does that by another name. And the House has a different version that's just as bad. That's probably the most clear-cut case where you recognize that the Republicans are not serious about fundamentally shifting the health care paradigm in America, which we need to be doing.
And you're right about the individual mandate and, of course, those tax subsidies. One of the things that Senator Paul suggests would be great for small business owners because they're the ones who were really penalized by even the idea of the employer mandate and being forced to pay for expensive health care for employees, which means you either don't grow your company or, you just don't have the money to hire enough people. He thinks that small businesses and individuals should be able to band together and buy insurance in a pool.
This is also, and I agree with that completely, and to the points that you were making in your monologue, which is that we have a market system for, for food, we have a market system for clothing, we have a market system for all sorts of stuff, and it works pretty well. We live in a medical system where after Obamacare and after the Republican health care reform, they were supposed to repeal and replace Obamacare. In the words of one of my Reason colleagues, this is all just Obamacare. It's just a little less of it. It's not going to get us to the place where, insurance companies or doctors compete to say, you know what, we're going to give you annual checkups and blood tests and other things for free as long as you agree to work with us if you have something more serious. We live in a country where we spend thousands of dollars a year or thousands of dollars a month for premiums for health insurance. Nobody knows what a blood test costs. Nobody actually knows, and these are the types of things.
That's a really good point. Some of these basic medical services that everyone has to engage in, and we simply don't know.
I mean, you might say, oh, well, it's $20 because I have a copay that I pay somebody, but then on the back end, everybody is charging all sorts of stuff. And until we actually root out that third-party payer system, which itself is a artifact of previous government interventions into the market, saying that health benefits are not compensation, so they don't get taxed. So then companies and workers want to have more put in that because it's kind of seen as free money. Until we get rid of that system and we're actually paying for service, and you say, you're giving me a blood test that costs $50 out of my pocket, the guy down the street says it's $20, why is yours better, et cetera. When we have that clarity of markets, of price signals, and of competition, we'll see what we see everywhere else, which is that quality goes up while prices go down.
Okay, now let me give you an example. We all know how important sleep is. Like, you would agree with that. Like, sleep is very important for maintaining a healthy being. So sleep is important. A mattress is important. You can go out and shop for a mattress. I mean, that's critical to your health. And you're not forced to pay $3,000 for a mattress. You can wait till one goes on sale. You can buy a disgusting lice-ridden used mattress.
You know what? I pay a premium for that, but absolutely. Or you can also return mattresses. I mean, there's actual customer service involved. Whereas if you're getting insurance through your employer, which the vast majority of Americans do, you have very limited choices. Not a bad thing, but I would much rather live in a world, and I think most people would, where your employer says, here's the money that we are spending on your health care. Take it. It's going to be taxed as income. It should be taxed as income. Go out and buy insurance, and people would have many more choices with what they want to do, and they can individualize it and tailor it for their particular situation.
Choice is heresy to progressives, unfortunately, who want a single-payer system.
Well, unfortunately, it's also heresy to Republicans, because this is, we have...
And insurance companies that they prop up.
And we have a Republican House, a Republican Senate, and a Republican White House, and they are not repealing and replacing Obamacare. They're kind of muddling along, and it's going to be, this means that it might be 4 years or whatever before we actually get to a place where we have actual reform.
Oh, mercy. Nick Gillespie, shining the light of freedom on all the darkness. Thank you so much.
Thank you.
Very good.